can join me. You can just stand.
I just need
Are you
bit
giving?
of
Yeah.
guidance on using this. Moving the slides.
This is moving forward.
Okay.
This one.
Okay.
Okay. Can I have your attention, please? We're going to get started with our lightning talk round. I'd like to introduce our first speaker. We're going to have three lightning talks, one in a row, and then I'm going to invite the three speakers to come back to the stage to have questions from the audience. If you have questions for them, you can wait till the end. But first I'm going to introduce Fred Mubira, who is a project manager at FHI 360. The name of his talk is Engaging Emanzis, Model Men in Uganda to Transform Gender Norms and Improve Health Outcomes. The second speaker is Johnnie. She's a youth ambassador from Washington, D.C., and is working with Plan International USA. And our last speaker is Amy Wells, who is a youth sector manager in Mercy Corps, Iraq. And the name of her talk is Age of Unrest, Adolescents at the Crossroads. Fred. Do you want to talk?
Okay. Thank you, Andrea. And I'm glad to be here at the Gender 360 Summit to speak about this intervention that we're doing in Uganda. So we've been talking a lot about how boys and men must be part of the solution to attaining gender equity. I'm going to tell you about a story about Mugisha, who participated in our Emanzis intervention in Uganda. Mugisha is a 24-year-old man who lives in Kanungu in southwestern Uganda. In a recent interview, he said, "Before I enrolled in the Emanzis sessions, I used to think that some home chores like cooking, fetching water, digging, fetching firewood, and even making a bed as activities meant for only women and not for men. I also never used to believe in family planning. I thought it was killing birth. I also used to be violent at home, and I would at times beat my wife or quarrel with her. I felt like I was the king in the home and not a partner to my wife." Mugisha John attended all of the Emanzis sessions, and now he says he benefited a lot from the intervention. The Act Like a Man and Acting Like a Woman session generally touched him. Through Emanzis sessions, he realized that there was no work at home that was only meant for a woman. Over the course of the 9 sessions, or during the 2-month period, Mugisha felt he learned how to behave as an Emanzi, a role model, and he started doing more household activities. As a result, he says, "The love with my wife, which had started reducing, has now increased. When I want to be violent, I fear what other men who saw me graduate as an Emanzi will say, and I don't beat my wife." Mugisha is now a role model in the community and who may potentially affect the positive change in the lives of other young men and women. The short story is demonstrating the impact of a male involvement intervention, the Emanzi, on promoting positive gender norms, healthy relationships, and male support for their spouse's health. So the Emanzi is implemented under the Advancing Partners and Communities Program, which is a USAID-funded, GSI-led project, and FHI 360 is the other partner. Principally, the Emanzi in Uganda is doing community-based family planning, but it also has other interventions on youth and gender activities. The Emanzi intervention in particular targets men mostly aged 18 to 45 years, with the aim to transform them into model men called Emanzis, who will in turn positively affect the attitudes of other men in the communities. Each group of the Emanzis is no more than 12 men. Although this intervention is not designed for adolescents as such, we are seeing that it is positively affecting the lives of young couples. About 1/4 of the men participating in our program are under 29 years. under 29 years. And the majority of which have wives that are several years younger than they are. Emanzis introduces the basic concepts of gender and gender norms, reflects on the health outcomes of harmful masculinities, healthy relationships, violence against women, discusses the benefits of family planning and HIV testing, and dispels myths about FP and condoms. It also discusses couple communication. The Emanzis curriculum is modeled after the Men as Partners curriculum designed by Gender Health, and the development of this curriculum took many years. Emanzis was first ever implemented and evaluated in southwestern Uganda in 2013, and the evaluation found that there were some positive changes, but none were really statistically significant. APC then modified the curriculum based on the evaluation results to focus on the areas that show some changes, like couples communication. It now includes more role plays and group discussions, and the groups, as I said earlier, no more than 12 men. The biggest changes in the curriculum were distilling the sessions to 1 hour and having them led by a pair of community health workers, or VHTs, rather than community elders. We also added a community celebration at the end of the Emanzis, where the men who graduate celebrate with their wives. The Emanzis has been implemented in 2 districts. One is Kanungu and the other is Kasese district. And to date, we've had over 850 men graduate, and many more want to join these groups. It has been emphasized at this meeting yesterday and through this morning that boys learn violence from their fathers, and it's important to have positive role models and mentors, which makes this intervention really important. One of the most inspiring things about this intervention has been the way the men in the rural communities of Kanungu district, a region which is more known for its mountain gorillas and tough men, have embraced this intervention and demonstrated how much they really value its contribution to their community. I was surprised when several of these Emanzis groups wanted to continue meeting so that they could keep discussing what they have learned and improve their livelihoods, even after the sessions ended. These groups started savings and income-generating activities on their own. It was really amazing. And one of the things they did was pool money to buy dishes. And you may wonder why dishes, but because they realized after going through the Emanzis sessions that they were not doing anything for their homes, and it was always their wives buying the dishes. So they decided to buy dishes. But others have also started rearing chickens, piglets, and they continue to meet when they are meeting to discuss their savings activities. So APC currently is evaluating the intervention in one of the districts in Kasese, and we are following a cohort of approximately 250 men and their wives. We are seeing some encouraging trends already. 94% of the cohort who attended all the 9 sessions, and we had 94% of them, completing the sessions. And 97% of their wives reported that they talked to them about what they discussed in the sessions. We have some highlights from a subset of men who are between the ages of 18 to 29 years that are participating, and the cohort also includes their wives. And the results are showing that after completing the Emanzis sessions, we found that the percent of wives who reported that they rarely talk to their husbands about family planning and HIV decreased by more than half. We are also finding that these young men and women, the percent that were very satisfied with their relationships dramatically increased after the intervention by more than 25%. We think that's quite encouraging. However, these are just preliminary findings, and at this stage, we hope that we shall be able to do another round of data collection at 6 months post-graduation to see whether the attitudes will have been sustained. I will then close with a story of a woman, Katushabe, a young wife of one of the Emanzis. She said during a recent visit that, "I'm very happy because of the changes my husband has undergone since he started attending the Emanzis education sessions. Before my husband joined the Emanzis classes, there was no cooperation between us at home. He was not participating in any domestic activities. All the money that he would get was for drinking alcohol, and he never contributed to the school fees of the children, not even buying a single exercise book. Whenever I would ask him to go to hospital for HIV testing with me, he would respond to me very rudely, and I would leave him for the fear that he would beat me. I thank the APC project very much, their coordinators, the village health team members, and whoever brought the Emanzis education sessions to our village. Now there's a lot of cooperation at home. We share domestic responsibilities, and he stopped drinking. This time, when the school term was beginning, he paid school fees for the children and bought books for the children. Whenever he gets money these days, he brings to me and we plan for it. He even told me his salary, which he never did before. Currently, recently he started encouraging me to go with him for family planning services, and we have gone for HIV testing together at the hospital. The whole country needs Emanzis so that all the men are reached with these very good and life-changing classes. This will benefit most women, as I'm also benefiting from the sessions that my husband attended. Thank you very much. And I want to appreciate all the people who are working on this program on the ground, my colleagues who are not here, like Ronald Kibonire, and of course the district and sub-county teams that we work with. Thank you very much.
Hello. Thanks, Fred. And I was previously introduced, but again, my name is Johnnie. I'm a bit close. My name is Johnnie. I'm 16. I'm from Washington, D.C., and I'm a Plan International USA youth advocate. And to get this started, I'd like to ask a question. So through a show of hands, how many of you have been harassed on the street? Or have taken a different route because you felt as though the most convenient one wasn't safe for you as a woman? Or if you've decided against an outfit that you liked because you felt as though someone would get the wrong idea from it. Fear causes us to do a lot of things, and gender-based violence manifests itself in many ways. Today, I'm going to talk about a particular event that changed my perspective on the issue and its relationship to our everyday lives. A few short months ago, in a matter of moments, my commute home from school went from normal to, well, scary. To contextualize the situation a bit, this past school year, I studied in Spain, and for a majority of the year, the bus drivers were on strike, which meant that every bus was extremely crowded, and every day, I spent about 10 minutes packed into a bus like sardines until I made it home from school. The experience was completely typical, up until some weird things started happening on the bus. I could see that an older man was trying to get my attention, and at first I didn't think anything of it. I assumed that he was trying to get the attention of someone standing nearby, or he was trying to make his way to the other side of the bus. He ends up standing next to me, and he starts off just staring, but then that turned into words that I couldn't quite make out on a really crowded bus. As stops passed and more people got off the bus, this man's eyes continued to be fixed on my face. My stop was approaching, so I moved closer towards the door, and he followed me and stood next to me. He asked if I wanted to go grab a drink with him, and I politely declined and told him that I would be on my way. But that didn't stop him from getting off the bus and walking with me. He keeps complimenting me and asking me all of these questions. Where are you from? Why are you in Spain? Can I have your number? Do you have a boyfriend? Are you going home? Do you live alone? And I just continued to politely tell him that I was not at all interested and that I would be on my way. I tried to look calm, but I'd never felt that uncomfortable in my life. And I had no idea that things would get worse. After that, I wasn't left alone. He finally agreed to leave, but he asked for a kiss before departing, which I firmly denied. At that point, I started to walk away, and he decides to grab my wrist and lean in to take the kiss that he was refused. I quickly turned my face away and tried to yank my wrist out of his hand, and it felt as though then he finally got the message that I was not at all interested. It felt as though that moment was never going to end. As we walked in opposite directions, every 10 seconds, I couldn't help but look over my shoulder to see if I was really walking alone. It took less than 5 minutes to get home, and I was looking forward to being back in a space where I felt comfortable. As I walked through the door, my host's mom asked me about my day, and I told her what happened. We chatted about it a bit, and she wasn't particularly surprised or shocked. When brainstorming ideas for this talk, I knew that I wanted to use a personal experience, but I didn't feel as though I had any experiences worth mentioning, shockingly enough. The most impactful part of the entire experience wasn't the aggressive behavior itself, but rather realizing that events like that aren't shocking, because they're viewed as a part of being a girl. What does it take to get people's attention? My story is one of a million, which raises the question of, what is it going to take for people to understand that all of these events come from the same place where policing women's bodies and behaviors is normalized? Through experiences like this one, I learned that my whole life I've been taught to be aware of being a female in a public space. I've been conditioned to always be aware of where I am, what I'm wearing, and a million other things that boys and men don't have to think about in the same way. A powerful quote from the victim's statement in the Brock Turner rape case made me think. In court, the victim read out, "Sometimes I think if I hadn't gone, then this never would have happened. But then I realized it would have happened just to someone else." It made me think about how when we teach girls to alter their behaviors, in a coded way we are telling them, this is going to happen to someone, and here are all of the things that you can do to make sure that that someone isn't you. We grow up hearing things like, he's mean to you because he likes you, and boys will be boys, which normalize and justify behaviors that can grow to be more serious than a boy just pushing you down on the playground. Girls are limited in ways that boys are not, and it does not have to be this way. Girls are limited in ways that boys aren't when walking down the street. And girls are limited in ways that boys aren't when it comes to many other aspects of life. I've been an advocate for plans since I was 10 years old, and I vividly remember being introduced to the topic of gender equality through learning about all of the obstacles that girls face when it comes to getting an education. As a 10-year-old, I was outraged at the fact that girls my age were getting married, having children, and not enjoying their childhoods because their options were taken away from them. Regardless of the situation, there is a certain universality in the female experience that girls themselves don't have any control over. At around 10, I also noticed that I was receiving attention that I hadn't received before. Now think about the first experiences in which you felt objectified and sexualized. Were you around the same age? The scary thing is, this isn't shocking. This is looked at as just a part of growing up, which is a problem. Violence in the world often starts in small, normalized ways. When you're taught that there are some things that you're expected to tolerate, the responsibility shifts from the person who should be at fault to you. You end up taking that different route. You end up taking all of these extra measures to make yourself feel safer. Because at the end of the day, not only do you dread something happening, but on a deeper level, you know that if something were to happen, the first question would be, so what did you do? Similarly to how girls are limited in ways that boys aren't, these experiences are considered normal, and it does not have to be this way. Through my involvement with PLAN, I have been able to help with campaigns focused on making gender equality for girls around the world a reality, and raise awareness for an issue that truly means a lot to me. Violence in the world often starts on a smaller scale, but so does positive change. So to conclude, I would like to issue a challenge to all of you. To share your stories, no matter how small. To invest in programming that empowers women and girls, or to continue to do that. And to talk about the issues to help create a new normal. Because as I said before, this doesn't have to be this way. Thank you.
Just gonna check this. Any suggestions? There we go.
The screen on
Pushes me forward. Okay. Hello, everybody. When I first spoke to Andrea on the phone, I was sitting in the office in Baghdad. When I hung up the phone, I thought, maybe I could just stay in the office. It's safer than being on the stage here. The first time I think Baghdad has ever won a security assessment in all time. But I'm here, and I hope I'll survive, and you'll survive the next 8 minutes. My goal today is threefold. First, to keep you all awake and engaged. Everybody's looking up, that's a good sign. To highlight and re-emphasize the need to make adolescents visible and part of our program design. And lastly, to leave you with some hope for the Middle East region and Iraq. No small task for 8 minutes. So I want to start by giving you a brief orientation of the complexity of the current crisis. This map gives you part of the story. 1 in 5 people are a Syrian refugee in Lebanon, 1 in 13 in Jordan. The numbers are astounding. We can read them over and over. But the fact is that the crisis is complex and affects the whole region. What you don't see here is where I live, in Iraq. In Iraq, there are Syrian refugees, internally displaced persons as a result of ISIS, and affected host communities. The numbers now, according to the HRP, which came out this year, are 10 million people affected by the crisis. That's 1 in every 3rd person are affected. It's in this environment and in this response that adolescents are getting lost. Governments see them as a threat. They don't fit into our systems, our clusters. They aren't adults, they aren't children. They aren't of working age, but they're working. They're not supposed to be parents, but they're mothers. They're seen as challenging and complicated. They're a protection risk, so don't do anything. They're hidden. Girls are kept at home, boys are working. It's all of these reasons that it makes it essential to work with adolescents. And on top of that, yesterday we talked about it a little bit, but to me this is critical. Between the ages of 12 and 25, which I'm way past, is the most creative phase in a person's brain development. This is when new ideas are created. This is when new ways of doing things are created. Yes, it can be a threat, but it's an absolute opportunity that's essential to tap into. It's these ideas that challenge norms. Mercy Corps released a report, The Age of Unrest, that I left on my table and was supposed to show you in March of this year. And it looks at the Syrian crisis, and it looks at what youth need in that report. What they heard, in line with what we've all been talking about, is number 1, youth need a diverse and complex response because they're diverse and complex. A multi-sector approach is required. One sector isn't going to cover the needs of youth. They want and need to be heard and partners in our interventions. And they want programs that focus on well-being, education, and employment. I'm going to tell you a few stories. So first, let me look at well-being and resilience. So as you know, young people affected by this crisis are experiencing profound emotional and mental challenges. This study actually found that 79% of the youth that were surveyed had lost a family member. 44% had gone through depression. 60% have witnessed someone being attacked, shot at, or beaten. To address these needs, we need psychosocial support, protective networks, and referral systems. To address resiliency, it can't be a one-size-fits-all approach. There's not a training manual for resiliency. It needs to be unique, an opportunity for youth to be creative, to remember and realize their creativity, and be agencies of change in a safe space. So for example, this young man, oops, how do I go backwards? There we go. This is Muhammad. He's a Syrian refugee. He is one of our youth leaders in our safe space. Yesterday we talked about giving up a little bit of control in terms of how we design our programs. Well, all of our programs, we survey the youth in the community around what they want to learn. Muhammad wanted to teach hip hop. Okay. Then he wanted to also engage IDPs, refugees, and host community, which is 3 languages in one course. We're like, okay, that'll be a little harder. All right. And then, the kicker, he wanted to engage girls and boys. So in this context, in this cultural context, that isn't quite what we do. And from a best practice standpoint, that's generally not how we approach this. So Mohammed talked to the community, he talked to staff, he talked to our teams. He now has a male-female IDP refugee host community hip-hop group that is amazing. I'm telling you, if anyone needs anybody, they want to sign this group, they are absolutely amazing. I'm not just saying it, I wish I had a video, I don't. So another issue that we want to address is education. So the complexities of access to education in Iraq, I'd have to sit here all day long just to get through half of them. Some of them are, if there are schools, they're in terrible state, they're destroyed, or they're incredibly overcrowded. There's no desks, people are sitting on the floor. Youth need documentation to attend their classes. So what that means is if you're a Syrian refugee, you need to go back to Syria and get your documentation. Not exactly a good trip. They also have language barriers to access the host community curriculum. Maybe they don't speak the language. And then most frequently, adolescents drop out of school. So access to education, particularly for girls, requires targeted interventions. And that means more time, more money, and more resources. So we need to invest more to get girls back into school. The girls you see on the pictures here, they are from Baghdad. We have a program that we run that works with household, community, and government level to get adolescents and internally displaced youth back to school. One of the girls you see on my right, your left, her family wasn't ready to send her back to school. The counselor that was assigned her case couldn't get her to come back. So we have trained mediators that went to her home regularly to talk to the family. And after 5 visits, she's back in school. I took that picture a year ago. She's still in school. In some cases, many cases, formal education isn't the pathway. Not everyone can access formal education services. So informal education is also really important to the way that we look at interventions for youth. Lastly, safe, fair, and decent jobs. You will notice a sewing course in that corner. I will address that. The reality is adolescents are working. So when someone tells you that we can't do programming, livelihoods programming for adolescents, okay, they're working. How do we want to address that? In Erbil, every day in Iraq, you're met on the street with young people selling you things. These jobs are not decent, they're not fair, and they're not making an income. The conditions are unsafe and the pay is poor. In most countries, there's tension, lots of tension, between the host community, IDPs, and refugees seeking jobs. The economy is terrible, there's no jobs, so then you have tensions. So safe, fair, and decent jobs require skill development coupled with job creation. It's not easy to do, but we have to do it. We're working to challenge norms around the requested and even overly simplified sewing courses. These were actually requested by the community. So how do we challenge even ourselves in the community to look at other opportunities for girls? It's not easy, but in the coming year, we're looking at doing startup weekends, if you've heard of this, for only women and girls. Also girl-led and girl-run business development courses. So looking at how they can create new jobs in different spaces that connect different skills to employment. I'll leave you with a story. I don't know where my 8 minutes are, but I'm almost done. In 2010, I traveled to Iraq for the first time to visit one of our programs. And when I did an assessment of the program, I found out 70% of the youth participating in that program were young men 20 and over. That leaves a very small window for girls and adolescents. After 2 years of being in Iraq, the team that you saw on the first slide, we are now reaching 10,000 adolescent youth, 48% adolescent girls, 52% adolescent boys. It is possible, and it is essential, to meet the needs of adolescent boys and girls if we're intentional. And they need to be part of that process. Thank you. Fred, come join us. You're amazing. You're amazing. Amazing. I need to take you on tour.
We're going to facilitate a question and answer period for Fred and Johnnie and Amy. But first I just want to say that I think one of the key themes that seems to thread among the three presentations is really about transformative change. Can happen in different kinds of contexts. And even you mentioned, all three of you, change that was happening either in yourselves and or among the communities that you're working. And so I think that even as we're doing this work, we change as much as those with whom we're working change, and we hope that they're changing. So I think we have some, do we have people? Yes. Are there any questions that you'd like to pose to Fred, Johnnie, and Amy?
I want to see if we can take Johnnie on a speaking tour around the world. Right? We have fun.
Try 360. There you go. I'm curious. I think you did an excellent job of laying out, some of the challenges that women face of all ages. What do you see are some of the solutions? Like, what would be your recommendation to us of things that we should focus on to better be able to help, make that different?
Awesome. This is on. I was fiddling with it up here. Like, oh, is it on? But I think one of the greatest solutions that we can put forth are programs that focus on creating safe spaces for girls where they can talk about the issues that they face, and also the existence of programs for boys starting from an early age, which really can help push from a very basic level through education a shift in societal norms. So that's the first thing that comes to mind, and I'm sure that there are many, many great solutions that can be thought up, but that's the first one that comes to mind, creating safe spaces for girls, and then taking that even further for boys coming into the picture and learning, oh, well, you shouldn't treat girls that way. So that's my thoughts.
Yes? Okay. Thank you. You can just start speaking. Hold on, 1 second.
Okay.
People could come up here and just...
Can you mute 7 real quick?
Come up here to the front and we'll use your...
And I have this one too. I have this.
Tree back and forth. Here we go.
Hello, my name is Mary Apollo from South Sudan. I just want to know how did you able to engage the men and women in your project? Because in Africa, still we have like cultural barriers in our societies. Like the project you came in by the gender-based violence still make a nonsense for our society. Like our society, we still suffering from poverty and the basic need, okay, for our communities. So when you come and then when you go and you propose your project, how did you get like the feedback from the society, and how were you able to achieve your goal? Thank you.
You guys can share that mic and I'll keep this out here.
Thank you. I can't recall the name, but thank you for the question. So this intervention initially targeted the men as you'd expect. It was designed as a male intervention, involvement intervention around, like I said, the project is a community-based family planning program, principally. But in the Southwest as well, we are also doing HIV integration. And so this intervention was meant to, involve men to support their spouses to be able to access the services that we provide. So we wanted to be transformative a bit, to have a gender transformative approach integrated within the intervention and not do business as usual, because of course we know for family planning, the unmet need is there, and you'd believe that the people just need the services, so take it. But we thought we need to have men support the spouses, as it has been shown in several studies that they are a barrier. So how we got the women involved is it was actually on request by the spouses of the men. When the men started attending the sessions, the wives, I think, appreciated the transformation. And as I said, we have a community celebration at the end where the spouses are invited to attend and listen to the testimonies that their husbands are giving. And through that process, they became interested in what was happening, the changes that are happening among their men. And eventually, we decided that we should also involve the spouses. But really, we don't have sessions for the wives. We only involve them at the celebration. And then in the other district where we are doing the evaluation, we have involved them as part of the cohort to be able to ascertain that the changes that the men are telling us are actually what the spouses are seeing eventually. So, but it is principally a male involvement intervention. And I think the other, you said that, I think, was it about the fact that in the communities people are struggling with basic needs, and how do you get them interested in this kind of intervention? Like I mentioned during my talk, that is one of the things that surprised us as well, that in this community, particularly in southwestern Uganda, in Kanungu, it's really rural, it's mountainous. That's where you have those beautiful mountain gorillas that are a few that are remaining. And the men in that area, they are the Bachiga men. They are known to be tough. We know them as tough men. But surprisingly, they picked interest in this intervention, which actually shows that men are actually willing to be engaged. It's not that they don't want to be engaged. Most of the times, no one has ever engaged them. And so once they have the opportunity, they understand the benefits, then they are willing to take up. Again, once the whole community realizes the changes happening to a certain few of them, then they pick interest in the intervention. Thank you very much.
Hand and the striped check shirt right here. Yes.
Hi, I'm Junaid Jamal. I come from Bangladesh, the Asia Foundation office. My question is to Frederick. I mean, in terms of Bangladesh, we have a very patriarchal society, and in there, harmful gender norms are not only spread by men, the husbands, but as well as the mother-in-laws and sister-in-laws. So they sometimes propagate these harmful social norms. So in terms of your experience working with the men, like, does anything in that way come up, or have you dealt with this in any other way in your programming, in your men engaged programming?
Thank you. Of course, with these transformative approaches, we have to recognize the significant others that will affect, the interest and the involvement of the men who are in these groups. And some of them have told stories about how people in their communities are saying, oh, now you're beginning to behave like a woman, and that kind of thing. And so how we are coming around that is we come through the leadership. We work through their leaders in the way that we engage them as well to have positive messages around the intervention as they go around speaking in their different fora. We are also trying to use radio. We've used radio to take these men out to speak and talk about the benefits they have got, you know. So it's a continuous engagement. As I'm sure just like in Bangladesh, even in Uganda, the people around you have a lot of influence in terms of forming the way you think about gender issues and masculinities. So, but we use a multifaceted approach to try and get around the problem. Thank you.
Any questions? Yes?
My name is Robert Dolan. Thank you. My question's for Amy. And in your adolescent groups, and you mentioned Mohammed, who wanted to create this mixed sex, mixed population hip hop group, which is awesome. How did you find, working with their communities to? So, kind of first question: were most of the groups mixed? So you said that we went from originally 70% men, then to 52% men and 48% women. Were they mixed? And if so, how did you find you and your team working with the communities to allow that? Or did you not find it as much of an issue because it was more at the adolescent age? Thank you.
Sure. Those are good questions. Let me see if I can. So first, in Iraq, there's different parts of the country, right? So in one region, education for adolescents is mixed, and for one region, it's segregated. The adolescent-friendly spaces that we run we segregate them normally. So every other day is, male access on Monday, girls come on Tuesday, like this, so that girls in the community can feel like they can access these places. And we also provide, which when I referred to resources, we also provide transportation and trained coaches that are female to escort essentially girls to the centers. In terms of the community, that was one thing in 8 minutes I didn't get to kind of highlight, but it's the entire adolescent-friendly space model is through community-based partners. So we work with community-based partners to run the spaces. They're actually owned, this physical space is owned by the government in most cases for sustainability purposes, and then the community owns and runs the space. So we have a protection network that comes out of this community. So the youth are part of the council that help inform the community-based organization that runs it. So does that make sense? So it's completely integrated from the beginning throughout the process. So when Mohammed had to make the case for this, he had to go kind of to a panel, to the parent panel, and say, this is what I want to do, which meant that it had to come on a different day of the week, and there was a lot of negotiating that had to happen, but the majority of the courses are actually segregated. And the point of that is to provide girls and boys with an opportunity to speak about very personal and sex-specific conversations.
Hi, my name is Judith. First, I would like to thank you all for an amazing conversation and some very important points. My question is for Amy. You talk about job opportunities for youth in a whole range of other sectors. Can you talk a little about the private sector? What are the conversations that the camp and the community is having with private sector and the business community to facilitate skills and job opportunities for youth if those things exist, and if they don't, how are you guys thinking about it? Because I think we can talk a lot about the social issues, but the economic component is so key. And even within those contexts of conflict and refugees, there are always opportunities. New markets are created, new opportunities are created. Share with us a little bit more about how they're looking both the future around what skills that you're helping to provide, but what are the opportunities for them to use those skills, from technology to food, whatever you may have it. Thank you.
This is another really complex question for Iraq and for the region. We have been working on a livelihoods development program and doing a lot of research around what the private sector looks like in Iraq. Can anybody guess what it might look like? It's pretty crap. I think we have, before the conflict, we're looking at like 7% investment of the private sector. But there is interest in both the government of Iraq and the Kurdish region to invest in private sector development. And so what we're trying to do is sync up with where the government is also trying to invest money, because we can't create the private sector, right? The only thing we can do is link onto it and then link youth to that. So in the context of Iraq, a lot of that looks at manufacturing and agriculture. And that fits with the audience and the kind of the lowest income levels that we're looking at working with. So the big part about building skills, I believe someone was talking about making construction sexy. Who was that? Was that you? So it is looking at ways to get girls into rebuilding of a nation. And that's something we haven't done yet, but we're hoping that these creative spaces and opportunities will be looking at manufacturing opportunities for women and girls as well.
A question here?
Hello, hi. Thank you for the presentations. My name is Astrid Gillis. I am with Management Sciences for Health. And my question is to Fred in regards to the Emanzis program. In the video, not only the video that you showed, but also the Papua New Guinea video, one of the gentlemen, I noticed that the gentleman said that they no longer hit their wives because they fear going to jail. And so my question is, in your programming and some of the activities and some of the lessons that you're transmitting to your participants, how are you ensuring that, well, number one, what are your thoughts about that? And number two, how are you ensuring that your participants are leaving with the understanding that it's just plain wrong and they shouldn't do it out of fear of being, jailed or out of those type of repercussions, but that it's just plain wrong. I know that it's a social and behavioral change that might take a long time to actually manifest. But how exactly are you ensuring that your participants understand that it's just plain wrong to inflict emotional and psychological and physical pain onto another human being? Thank you.
Thank you. So the way we are doing it is in the way the curriculum is designed. It's really designed to promote, partner communication, positive relationships, and shared decision making. And it includes a lot of role play, role modeling, as they keep discussing. So it's really telling them about the benefits that they would have if they treat their spouses well. For instance, that if they are, discussing their savings with their spouse, then they will have more money saved to educate their children. And if they're discussing their health issues with their spouses, then maybe they might avoid HIV and things like that. So it's really talking to them about the positive outcomes that would come out of, living as good men and treating their spouses well. We do not have any messages regarding, telling them that if you do this, you will go to jail or anything like that. We don't have any sessions telling them about the repercussions of doing it, but we only talk about the positive outcomes that they would see. Thank you.
I'm going to ask the last question based on timing. I wanted to ask a question of all three of you to see what you think. So in the last day and a half, we've been talking about adolescents, engaging adolescents, and having them be a part of the design of programs. And I think we all agree that that's an important goal that we can have when we are planning programs and designing programs and implementing, but it doesn't always actually happen. So my question to each of you is, how do you think, what is the best way that adolescents can actually be a part of the design of programs whose goal is to bring about transformative change on gender norms? And maybe we can start with Johnnie.
Sure. Here.
So something that I've always applauded, planned for, are the existence of youth advisory boards, and not just because I serve on ours at Plan International USA. Excuse me. But because they really are important to making youth feel like their voices are heard. And when it comes to programming, us at the Plan USA Youth Advisory Board, we've had the opportunity to provide input on different aspects of the organization. And it's really not only created a connection between us and the organization, but also with what the organization is doing. So we have a lot of passionate young people out there ready to make an active change. And I think it's really important that organizations do invest in making youth voices accessible and making sure that they are incorporated. So through things like youth advisory boards and having youth on the board. And as Tessie mentioned yesterday, the Plan Federation has, I want to say 39 youth advisory boards, and we're in over 70 countries. And we're going to see the benefits of that in the years to come, but it's definitely something that should be thought about more often.
Thank you, Johnnie. Amy?
Agreed with her. Also, I think that the reason, at least what I see in the field, is that the reason people don't design with adolescents, with girls and boys, is because they don't know how. And I think it's because it's complex already. You have really ridiculous timelines and huge budgets and hundreds of staff to train. So how on earth do we now include youth? And I think for me, I mean, I didn't know, how to do this 10 years ago, but the Population Council has some really incredible tools, and I have gone through a lot of their trainings in the Girl Centered Design Toolkit. I know everybody talks about toolkits, blah, blah, but it's really useful. But I think that just working with the team, looking through the tools, and then, at the beginning, when you're doing the outreach, there's just making sure you find these adolescents at the beginning and every step of the way, checking in. Advisory boards are great, but within programs too, starting with them. And it's just about intentionality. Really, truly, it's not that hard. It just seems really distant or complex.
Okay, thank you. And so maybe to bring that out well, I'll talk about one of the interventions that I've been involved in previously, and that's the GREAT project with Georgetown, but which we are also scaling up in northern Uganda as part of this program. I think people have talked so much about intentional, if you want to involve adolescents, being intentional. And it should be, I think, by design, the way you design the intervention should be intentional in involving the adolescents. So like thinking about what outcomes do you want to see among the adolescents, and then as you develop the interventions that should take them there, the adolescents are involved. So like with GREAT, they were involved in the pre-testing of the toolkits and all that business until, So I think you have to, by design, intend to involve them from the start. And that should work. Thank you.
Okay, great. So in light of the fact that we have a donor panel this afternoon, hopefully we can keep all of these recommendations in mind and how we can engage youth in the design of our future and even our current programs. So I'd like to thank very much Fred and Johnnie and Amy.
Thank you.
And we'll transition to the next panel.
Thank you.
Thank you.